Sarah, that's for cats. Come on.
Oh, dang it. But it's true. It's so good.
Pet treat only. Welcome to Class Act Chats, where we talk cat behavior, cat training, and cat care. Today's guest is Sarah Batcherer. Sarah and I were talking a couple weeks ago about a sometimes forgotten resource for cats in your home, and I knew I had to have her on. We had a fabulous talk filled with her knowledge of animal behavior and training, as she works with both cats and dogs. We talked about all sorts of things, ranging from cat resources to a forgotten resource for people in your home. Let's get to it, because you're gonna love Sarah. Well, Sarah, welcome to Class Act Chats. I am excited to have you here.
I'm excited to see where this goes.
So before we go any further, I want to just start out with, because I know who you are, but people tuning in may not know who you are. Who are you? Why should people trust you? Why should they trust that you know what you're talking about?
I am a certified veterinary technologist, so I have a bachelor's in veterinary technology, kind of on the nursing side with whatever label you want to use for that. And I've been a CVT for 15 years, and about 6-7 years ago, I started my behavior journey and became fear-free certified, started working at a veterinary behavior clinic where I became a certified behavior canine consultant and low stress handling silver certified and a certified family dog mediator and master course of aggression through Michael Shikashio's program, and then ultimately became a veterinary technician specialist in behavior.
So you're like Campbell's soup, like you have the full alphabet soup of letters.
Yeah, I think the more credentials or letters or experience or continuing education, all the different things, I think the more you do, the less you feel like you know. And it's almost like the imposter syndrome gets worse. You're like, oh, there's now this new book and that new book and this new book. You can't keep up with it. Actually, hearkening back to your Class Act Chats with Michael Delgado is like, I am willing to say I don't know everything, and I'm not sure. We've got 3 different routes that we could try, and I don't know which route's going to be the best. We could go with this one and see what happens. Yeah, that's one of the things that I'll refer to for clients or family or friends that are working with me. The website Preventative Vet has a blog post, and I'm blanking on the author's name. I'm so sorry. But what alphabet soup? What does that dog trainer's certification mean? And I feel that that's really helpful for people to have an understanding that there are letters out there. There are certifications in an unregulated field. Just because there are letters doesn't mean that you're going to match up with the resources or services that you or your individual pet might benefit from.
Yep. And so anyone could call themselves, whatever title they're using.
I'm a certified fairy godmother. Yeah.
Yeah. I am a certified snack expert. I am an expert in eating snacks.
Jealous.
You have to get endorsed by the Keebler Elf, and I did find out over the weekend you could become a certified cheese professional. I had no idea that was a thing. I'm not gonna lie, it's tempting because I do love cheese.
I mean, yeah, I think that you're not supposed to eat cheese before bed for a variety of reasons.
Why? You're taking one of the subtle joys out of life, where you get to go and just eat, have a bed cheese.
We should all have a cheese fridge next to our beds.
I feel like that should be a standard feature in most homes.
Right? Realtors need to get on.
Yeah, and here's the cheese fridge.
You don't need a wine fridge, you need the cheese fridge.
Yeah, it's like, screw your wine fridge. I want a fridge. I want a cheese cellar that's installed. Like wine cellars, whatever. I want some aged Gouda.
My husband's all across the house. I thought she was going to be talking about her profession. They're talking about cheese fridges?
And then we end, and your husband's like, what is this weird charge that just appeared on your card? And you're going to be like, well, while we were talking, I ordered a cheese fridge. Well, but to be fair, to be fair, one could theoretically use cheese to train a cat or a dog, or really, I mean, me. You could use, us. Now I'm envisioning a charcuterie board that someone has a clicker, click, you get a cube of cheese, click, you get a cube of cheese, click, you get a cube of cheese. So you were saying, why should we trust you other than you have good taste in dairy products?
I have a really firm belief that any case that we work with, that I work with, I should say, I like to approach with humility as well as transparency that I do not have the final say, nor do the pet's parents or caregivers or whomever's working with that animal have the final say in how things will go, because we are working with a sentient being that responds to its environment and previous experiences in a way that what I tell families I work with is time and Fluffy will let us know what's working.
It's really nice seeing that people are recognizing that their pets that they live with are living creatures that have preferences and needs, and that we are actively choosing to bring them into our homes, and that we have to adapt to them, and we can't just expect them to sit there and do something that, well, actually, in the case of cats, we can't just expect them to sit there. They're not just decorative pets. They're living being creatures that have preferences and needs and wants. And if you're poutine, you have a singing hobby that you need to scream constantly at me. I love him a lot, but he's loud. And Prozac Prozac is just cute, let's be honest. But he does run a cult, so
I think a fair number of cats would prefer to run a cult. The other part that I think of when I think about trusting people is I'm willing to say that just because I have letters doesn't mean that somebody without letters isn't just as valuable in their knowledge, experience, and abilities to help.
I like to look at it kind of as like there's varying degrees of experts where like someone has experiences that I don't necessarily have, so they're going to be an expert in other areas, and people that we would work with are going to be experts in their individual cats, where they're going to see what their cats are doing, or their dogs are doing, or their hippopotamuses are doing, or hippopotamuses. Is it hippopotami or I don't actually know what the plural is. No, I think it's important to be able to recognize like the expertise that everyone has, and also just that nobody has all of the answers. It's being able to say I don't know is really powerful and really important, because everyone has their things that they're good at and the things that they've learned and things that they're very, very, very knowledgeable in. And there's plenty of people with a lot of letters that on certain topics I would just not trust.
No comment.
Yep, no comment.
Sharing a little bit of personal background in it too is, for my husband and I to have the baby that we just joined us in February, we went through a 4-year journey, and 6 to 7 different doctors that I met with, and a variety of different, I essentially had to get spayed in order to have IVF. And so I can't physically I can't get pregnant naturally.
The way you phrase that, I'm just like, you what?
I woke up from the surgery knowing they were going to take one tube, and then the doctor was like, we had to take both tubes. And then I was just called, I'm pretty sure they just told me I got spayed. Ended up having successful IVF, beautiful daughter. We're super happy when she's sleeping and eating and not crying. We're super happy about the addition to our family. But the number of people that I saw and the journey, the ups and the downs and the gray areas and the unknowns, it was similar to, I think, a lot of the families that people who work in behavior modification work with, in terms of we don't have all the answers. We don't have all the whys. We're going to go with this first plan. And if it doesn't quite pan out, then we have another plan, or we can try a different thing. And that throughout that process, you might find that you don't jive or connect, or you might lose trust for whatever reason with one of the professionals you're working with. And I'm not offended if anybody ever feels that way working with me. I would rather families work with somebody that they feel they are getting what they are looking for out of whomever they are contracting with. It's totally fine, because I definitely switched around who I was working with in order to get pregnant.
There's nothing wrong with seeking another opinion, or if whoever you're working with, the way that they work just isn't for you, that's okay. I know I take an approach that isn't going to work for everyone, and you take an approach that isn't going to work for everyone. And it's why it's good that there's a variety of different people, because not everyone is a good fit, and it's nothing against anyone. It just is the reality, and it's better to try and get people connected with someone who it is going to work better.
Right.
One of those things that I find that like I have to often send people for more information is just the veterinary side of things, because I obviously can't diagnose any illness. I'm not a vet. I can't diagnose any illnesses. Right. I can't prescribe meds, but it's also part of the journey is that we have to recognize when we've hit our limits and when something is medical versus like a behavior concern, and when to refer to someone who has a different expertise.
In terms of what we do in the support role as veterinary technicians, they're in the state of Minnesota, they have passed the Practice Act in 2024. It's going into effect in 26. So now anybody that is a certified veterinary technician can become a licensed veterinary technician, and we will have some oversight similar to veterinarians. If you are certified, in most states, that's usually a self-regulating title and certification, whereas states that have licensed or registered, typically there is some sort of governmental body oversight. Next year, I'll be a licensed veterinary technician.
Yes. It kind of reminds me of dietitians versus like nutritionists, where like if you are a registered dietitian, that's a very protected title, but I could go on some janky website and do a 3-minute course on nutrition and get a certificate and call myself a nutritionist or even a certified nutritionist. And it's good to have some of that protection, because that way when people see those letters, they can hopefully understand, okay, like you have a license. It's if you're not doing things up to the standard of care and the scope of your practice, then
yes. My lens whenever I'm looking at any cases that I'm working with is my first lens, besides just sort of a zoomed out welfare, food, shelter. There's more than just food and shelter that we are providing in terms of welfare, and I'm sure we can dive into that later. It's not just that broad scope. Okay, do I need to check some boxes in the 5 freedoms of animal welfare? But is there something medical that could be going on? Because that is the first and foremost rule out whenever working with, say, a veterinary behaviorist. There's a good percentage. There's different percentages with different studies, depending on what you're looking at, in terms of how many cases that present to veterinary behaviorists actually have some sort of underlying medical component that is contributing to or the root cause of the behavior.
I feel like I see a lot of cases, especially in older cats, where cats just aren't responding how I would expect, given that client is doing a great job implementing things.
Right.
I should be seeing something, and I have a tendency to be like, let's go back to your vet and see what's going on here. And oftentimes there's something there, and it may not be something obvious, but there's something happening. Do you have any suggestions for people who may be suspicious that there's a medical component going on? Do they just set up an appointment with their vet? Like, what would that process look like?
Well, it's tricky as a veterinary professional, because you're not just learning a single species or a single age range or a specific body process or body part. You are learning at least 2 species, if not a dozen to a couple dozen species, all of their age ranges, all of the different diseases and comorbidities that can occur within those species. And then on top of that, how those diseases might have some sort of zoonotic component in terms of passing onto human. And so you also have the public health safety components that you have to take into consideration with those things. As a primary veterinarian, that's a lot of mental overload to try to keep track of. And part of why the veterinary field just loves whatever kinds of like algorithms and, 5-minute manual to this type of whatever, because it is impossible and unrealistic for people to feel like veterinary professionals, and really any professional in any field, should know everything. Behavior is only taught at like less than a half dozen of the over 33 veterinary colleges in the States. So the likelihood of going to a primary care veterinarian and them either being exposed to veterinary behavior information or being able to have the bandwidth. I think of it very similarly to if I, as a human, was going to go to my general practitioner and say, I have this tremendous fear of flying to the point that I'm hyperventilating and I'm almost getting pulled out of the airport because of how significant of a response I have and anxiety. While my GP might say, oh, okay, sure, I don't know, here's some Xanax, try that. And then I go back and say, I mean, it kind of helped, but also I kind of have PTSD because of blah, 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 blah. Your GP is going to say, that is out of my wheelhouse. I recommend you seek a mental health professional. So there is that sort of flow chart, I guess, in the veterinary field as well. So there are some things that people can do that can help with that. There are a variety. If you go to that alphabet soup, what does that dog certification mean? A lot of the certifications that are in there for professionals that have some of that medical or academic behavioral background apply to single or multiple species. And those are sometimes some of the places that I would go if we are really seriously concerned about a medical component and a primary veterinarian has given a clean bill of health. The snapshot of what your primary veterinarian is going to see after the stress of getting in the car ride, the parking lot, the lobby, the exam room, waiting, people coming in and out, what they're going to see in that microcosm snapshot is likely not anything symptomatic to give them a lot to go on of where to start doing some rule in, rule out what possible medical conditions could go on. Whereas when you're working with a behavior-oriented professional, we're looking at things like one of my clients that has a 4-year-old cat that I'm working with on their behavior questionnaire had commented that their cat doesn't necessarily like to jump high. And she's always been sensitive at her rear end, whether it's petting or brushing, and then most recently response to handling at the veterinary clinic for vaccines. And in my head, I'm thinking, well, there are some recent studies that come out showing that even young, single-digit, less than 5-year-old cats can have arthritis.
Yep.
So is it really that there could be something anatomically going on with this cat? It's difficult for them to be able to say, I've got 5 to 15 minutes with you, and let me tell you that there are 7 different medical conditions that could be influencing the behavior. Whereas somebody with my background would be able to say, here are the different things that you're telling me about your cat's behaviors and response to your interactions. And here are some different body systems that could be influencing that. I'm going to share that with your primary veterinarian because they probably don't have the time to go into that. And then that can help the veterinarian take a finer tooth comb to assessing your pet.
I think it was Tabitha Kucera that I remember. I was attending a lecture that she was giving on pain, and one of the most valuable things that I took from that lecture, other than everything, because Tabitha is a genius, but I love Tabitha. We are obsessed with Tabitha around here. I remember one of the most valuable things that Tabitha said was getting video of the cat walking normally, of them leaping up and down off of things, of the cat just doing day-to-day stuff, and telling your clients to get that video very specifically and share it with their vet and see if their vet sees anything has been huge, because I figure that way I can hopefully provide the vet with some good information about the cat. And it's something that I figure that way I can let the expert who is actually going to have that medical knowledge and can be like, gee, your cat is walking funny, take a look at it and make that determination. And this way, hopefully they have, if the cat isn't, moving around normally at the vet's office, which is very common, they can still see the cat acting in a normal way and be like, yes, that's problematic. And I've had more than a few times where that was like, everything's normal. And then I'm like, please take the video back to your vet and see if they change their mind. And they will sometimes change their mind and be like, oh yeah, that was not how they were walking in the office, which makes sense because the cat's not behaving normally in a vet office.
I have a veterinary exam or veterinary assessment referral form that when I meet with a family and I say, I've gotten this information from the client. This is probably more detailed than they've ever shared with their primary veterinarian. I have concerns. I don't know what it is. I can't diagnose, prescribe, cut, those things. But I know enough to know that something might be off in this area. And even if that's not off, it could be this other area. And so I will share the either observed behaviors that I have observed, if video, include the video, or my clients' observed behaviors. And I'll include, I'm working with this family, the client has shared this history, or I observe these behaviors. I have concern for multiple bodily systems that could be influencing this behavior, and be happy to share resources if you'd like, or video if you'd like, if I don't already have that attached. And then I'll check off, like, I want skin checked, I want vision or hearing, I want, orthopedic. And so I often having that where the vet can have the bullet points of what are cat is not jumping, on surfaces higher than 3 feet. Cat is highly sensitive and will reflexively, turn their head back when anything is touching its rear end. Whatever those additional symptoms are, as well as I have requested the client take video and we'll share those with you, kind of thing, if we haven't been able to get it. Which then leads to my secondary thought, is one of the things that can be so valuable working with behavior professionals. If we just get descriptions of the behavior and the response within the environment, we can sometimes be missing crucial pieces of information. For example, if a client checks off, my cat doesn't jump on to high spaces, you and I might hear that and go, ooh, there could be something going on. There could be kidney stones. There could be bladder stones. There could be orthopedic. There could be all of these myriad different things, right? However, once we either walk into their home or do a virtual consultation where we can get a video tour, there might not be any surfaces higher than 3 feet for that cat to jump up to or explore.
I started getting people to send me a video tour of their home. And that's like the thing that I'm like, before a session, do the video tour, because it's so valuable to actually see the space and see some of those things. And people underestimate how much the environment can impact the behavior of the cat. And maybe this is a little bit of a hot take. I don't know. I'm going to label it a hot take, though, in case it is. But I think that seeing the environment in a lot of cases is actually more important than seeing the cat directly doing the behavior. And again, I say a lot of cases because no, not all the time, but I feel like if I were to be like, okay, for some reason I can only get one or the other, I would pick the environment, because that often tells you just so much about what's going on.
It totally has me thinking of kind of circling back to those 5 freedoms, right? Like the veterinary field especially is, and I think the majority of pet families are very familiar with freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, disease. Like that's what the veterinary field is there for primarily. But there's 4 and 5, express normal behavior and freedom from fear and distress. The physical environment might both prevent and contribute to those 4 and 5. So no, I don't necessarily need to see the behavior, because if your environment is telling me that they are getting exposed to fear and distress, or they don't have the ability to express species appropriate behaviors, then we might need to just make those modifications, and the behavior can kind of self-rectify in some cases.
And a lot of times it doesn't need to be a ton of work. I think of like the number of times I've been like, oh, put a scratching post right there, but get a good scratching post, or put a cat tree in that spot, and the cat will love it. They'll use it. They'll stop being quite as territorial and guarding your couch. It is high. It really is hard to actually address the behavior unless you take the environment into account, especially with cats, because we basically control their entire environment. It's up to us. And not that that's not true with dogs, it's just with cats, it's typically a little bit more than it would be with dogs. And actually, it reminds me of like the freedom to express natural behaviors, I think of with dogs, like with dogs sniffing, and how some people will be like, don't sniff anything. And it's like, that's an important thing for dogs. They need to sniff.
Yes.
That's how they learn about the world, or at least it's part of it. I wish that we would do a better job of letting our animals be the animals that they are, and embracing that and celebrating that just unique perspective, and that unique, those quirks, those kind of amusing, funny things that they do that are species specific behaviors, that we didn't focus so much on repressing behavior.
Right. And this is a hot take that will have some people incredibly up in arms, because
let me get my fan here.
They're going to have their own mental picture of what they envision me having done without having actually seen what happened. But if I would not have let my dog, in a safe capacity, sniff our baby, he would be more distressed with her presence, and it would take longer for him to have initially acclimated to her.
Yeah. And I see, just for the record, Sarah, I'm assuming that this is the case. She did not like cover her baby in like meat juice or anything and then was like, sniffer. It was not dangerous. Yes, she covered her baby in churu, like, which, you know, I mean, it's good for her to get used to the traditional Sunday night churu bath that everyone does, correct? Right? That's a normal thing? Not just me?
For sure.
This got uncomfortable really fast.
No, I mean, I did, you know, some prep with a baby doll. I didn't necessarily have the time or bandwidth or physical ability to do as much baby prep as some animals do require. I know what I know about myself and my dog and the environment that we're in. And so I knew what things would definitely need prepping ahead of time, and what things would, this is such a hot take, because it's, you know, you say the word trust, right? And what does that mean? What does that look like? And can you measure, and what's the data? But what are things that I felt relatively comfortable with my hypothesis that, although I couldn't completely predict a single behavior response, I had hypotheses about a few different types of behavior responses to several different types of baby-related activities, and had follow-up consequences, ABCs, follow-up consequences to what different behavior responses we might see. And I have a reservation dog. He came from the Dakotas. His first 2 years of life was an uncontrolled environment that he learned how to assess, respond, and adapt to. So the more I try to control that now in an already significantly controlled lifestyle, the more stressful that is for him.
Oh, woof. Hang on. Let me open this can of worms here really quick. Oh, man. Yeah, you have to relinquish control a little bit, where there's certain things that, yes, you need to control it. Like, for example, all of my cords are covered in cord covers because Poutine will absolutely try chewing on them. And if I don't, bad things would happen. That is different than trying to be like, Poutine, be cute, or whatever it is that I'm trying to not have him do. But like, again, not allowing your dog to sniff your child, especially in your case, that's going to result in bad things. And we see that a lot with cats, where like, the more you try and repress the cat climbing on things, the more you try and repress them like scratching at all, not necessarily trying to work at them or work with them to scratch in a place that's acceptable to you, but like no scratching and just focusing on the stop part of it. That isn't going, bad things are going to happen. You're not going to like the results because the animal's going to end up frustrated. I am going to transition here because I really want to hear more about something that we talked about prior to starting this. And I'm not gonna lie, I'm gonna sell this in a very clickbaity way, where there's the unknown resource for your cats that like you aren't thinking of. Sarah, can you share some of your theory about this mystery resource and what it is?
Here's what I think about. When I think about cats, whether they're navigating an exclusively indoor lifestyle, a mixed indoor-outdoor, or outdoor style, they have pathways that they go about in order to hunt and forage and toilet and rest. And they utilize those spaces very specifically and strategically in order to reduce conflict with other conspecifics, other cats that aren't in their bonded group if they are part of a bonded group, right? The way that I view those pathways, and I think about, there was a Royal Veterinary College back in like 2012 did a GPS collar study and assessed 50 cats in Surrey or something like that, and monitored all these different cats and their different paths that they went when they left the household, and could even get down to like centimeter distance that the cats were going. And I'm thinking, oh my God, I want to try that so bad.
Sounds so cool.
But it does. Because I think that could be really monumental in helping inter-cat dynamics in households, because I think of cat pathways within a household very similarly to how humans utilize roads and sidewalks. We as humans view roads as a resource to gain access to other resources. The condition of those roads, the crowding of those roads, the urgency that you have to access your resource, all of those things influence our behaviors when we are out and about and have left our house, and even within our house. Like if you ever lived with a person and they're in the way when you have to get to the bathroom, or you're trying to like get to the cupboard, why don't they understand that you're needing to get to that cupboard? It leads
getting between me and my snacks. It's unacceptable.
What is this cat's general pathway that they take within this environment for this resource or this time of day? It can really shed a lot of light on, can we modify the pathways in a way that promotes a sense of safety in multi-cat houses and expands their enrichment in a way that meets that natural species behavior of hunting and foraging.
It is so critical in multi-cat homes that you have these pathways. And I'm not gonna lie, I've typically thought of it as being like the actual resource that the pathways would be leading to. But since we've talked about this, I've actually mentioned with a couple of clients, I was like, boy, do I have this genius like idea. My mind is blown about this concept that think of the pathways themselves as being a resource, because they're another critical component of a multi-cat home in particular, is that the cats need to have multiple ways to get to all of the things, the other resources that they need. And yeah, I love the idea of thinking of them as a road, because roads are resources to us. I mean, yeah, you could drive through someone's yard. It's just that's going to probably result in at least a fine, if not jail time. And you're not going to be very popular if you do that. But if you go on a road, yeah, like it's no conflict. Well, I shouldn't say that. They're assuming you are driving well and nobody else is making poor choices, there shouldn't be conflict.
And I've been experiencing this even just firsthand with my dog, and the addition not just of a baby in the household, but the gear that comes with a baby and how that influences his walking paths to different areas of the house. And now a path that was there a week ago, yesterday, this morning, is now taken up by this baby activity center. That sometimes that activity center is there, and sometimes it's there, and sometimes it's here. And now it's kind of like, construction season in Minnesota, right? Like, well, I know that's going to be off limits for a while, but wait, I didn't know that this spot was going to, now I can't do that detour. Like, how stressful is it for us during construction season? That's what's happening for our cats and dogs within their house. And we think, all we did was just get some new furniture, or all we did was just move around or have this, construction remodel type thing happened. But no, we literally just did a MnDOT overhaul on how they have previously known to navigate their environment. Yep.
All I know is that I can't get to, my snacks, which, as we've established, is unacceptable crime. Again, it's not weird that they would be upset by that. It makes a lot of sense, because again, it would be like me being cut off from my cheese fridge. I would be very upset with that, now that I know that that's a necessary part of my day-to-day life. What are some suggestions that you'd have for people who might be having a baby or combining households? Or, I hope not a lot of them are kidnapping children and like bringing them into their home, but again, we're not here to judge whatever the situation is. Do you have any like tips for people to think about the environment environment and things that they should or shouldn't do to try and help their animals adapt?
The ability to have the same amount of time and routine interactions with my pet, my dog Derpy, prepartum versus postpartum was so significantly underestimated. That's the first thing, is allow a lot of grace. There's not always going to be the ability to do what you want to do.
You can try and be like, I want to do things perfectly and like have all these like, oh, I'm going to clicker train my dog to bring me a bottle and like that way they can be bestie. Like my dog can bring my daughter snacks and like, no, like once you are actually in the situation, like, good luck.
So I have some stationary stations. So in my kitchen, I have a designated spot that if my dog's gonna be in the kitchen and I either want him to stay someplace or go someplace, that is the spot that I tell him to go to. There's a lot of different things that happen there, but for me, for example, if he's gonna get food from me in the kitchen, he's gotta be on that station. Teaching, here's a spot that I want your body to go or be. And that I feel is really crucial whenever you're going to have a major change in the environment, whether it's that you're moving houses, you're moving somebody in or out, there's a baby addition, there's a death, whatever it is. I think having a really rich history, a really heavily reinforced history of here's where I want your body to go when X, Y, and Z. Or it's this time of day, here's where I want your body to go. Those I feel are really crucial whenever there are those major life changes. But that's where I usually start, is what are the patterns that we can introduce before those changes so that we can keep that as a steady during and after the change.
Some of these interventions or these patterns don't need to be complicated. You don't have to do a ton of work to try and work with your animal on a behavior. There's nothing wrong with using a gate if that to keep your dog or cat out of the, I don't know, room of dangerous plants or whatever. Do what you need to do, and some of those things, they're not harmful to the animal, they're not causing them, any sort of pain or distress, and it just makes life easier for everyone involved. And especially like if you're a new parent, then don't be afraid to slap that easy button. There's nothing wrong with that. You're doing the best you can, and then put your effort elsewhere. And you don't need to do beautiful training to have it be functional. It doesn't need to be training that would win an award. It just needs to work with the animal and listen to them and be kind and be functional. Sarah, are you familiar with Control Unleashed?
Yes.
Oh, we love Control Unleashed around here, especially because it works really well for cats. And one of my favorite Control Unleashed pattern games is 1, 2, 3, or 1, 2, 3 treat, as the case may be. I sometimes like to leave off the treat part because that's just the full instructions of how you play the game, where you literally just say 1, 2, 3, and then give the animal a treat. I love that pattern game because it's so easy and there's so many different ways you can use it. And like you said, the predictability and the patterns, that's a very easy thing for people to implement. Like, even if their baby's already there, or the death that already happened, or their roommate already moved in, or whatever the change may be, you can start doing it even afterwards, and it just adds a little bit of predictability. And it's a way of communicating with the animal, like saying, hey, you're going to get something tasty. Or I just had a client that I did 1, 2, 3 play with, where the cat was a little bit less motivated by treats, but they were like, we want to play. So we did 1, 2, 3 play, and it worked. And it was amazing. So
one of the things I would recommend is essentially like a hybrid of Steve Dale and Leslie McDivitt's pattern games. And somebody else might be doing something like this, and it might not be revolutionary at all, but sort of a variable pattern treasure hunt. And I recommend in those situations that families kind of map out minimum 20 spots over the long run. But there's going to be 5 spots that are sort of like the always present. And what you would do is house away your cat where they can't necessarily see where you have put food, usually food. It could be toys if you have a toy preference cat, but you're going to have like 5 spots that are every time.
Sarah, I just like to put a plug in here for catnip too,
Yeah.
because we do like
The
the
big
fun
catnip.
plants around here. We are very shady at Class Act Cats.
You could definitely do catnip. You could definitely. But what I'll typically recommend is map out 20 spots that you're okay. And I want these to be like floor to ceiling height spots. 20 spots that you're okay with having little stashes of things. And secure away your cat in a location that they are comfortable being secured away in. If this is a multi-cat household, you might be securing multiple cats. And you're gonna let one cat out at a time, or if you're a solo cat, let your cat out. And you'll take them around to the spots. Let's start out with 5 spots. And you can do this at mealtime, and it is going to take, an extra minute or 2 of your time. But set out food, a couple of kibble, a treat, a little lick of churu, a little bit of catnip, and you're going to set out these 5 spots and take your cat to those 5 spots. You're going to do that, I don't know, a few days in a row. They'll probably figure it out after a few days that I'm going to go to those 5 spots. But then you're going to start layering in a couple of extras in between. Now, where it becomes a variable pattern is depending on your household layout, right? Like if you're in an apartment, you might have 3 spots that are always there, right? But then you could have up to 15 to 20 other spots that when you go to lay out your pattern of food or catnip or whatever, you're going to vary where you're going to put those extra spots.
So it's like an Easter egg hunt. Listen to this idea. So this concept, but with mini cheese fridges, and like you have like your husband hide cheese around the house for you. That way, like if you're having a stressful day, which cheese fridge has the cheese, and like what kind of cheese is in it? Is it a Gouda in one fridge? Is it chèvre in another fridge? Is it, and then like also what kind of chèvre? Like is it the kind with the cinnamon cranberry ones? Is it the blueberry vanilla? I see this as being adaptable to people too.
In general, they have locations that they go to hunt, and the more that cats are domesticated with us, the more they know where there are predictable areas of food. Even though we might not be able to let all of our cats outdoors to express those natural behaviors of hunting and foraging and those 10 to 20 micro meals a day, we can replicate that to a certain extent by saying around mealtime or randomly in the day, because something's changed in your life and I want to give you something familiar. I'm going to put you in the bathroom. I'm going to put out the 3 spots that you'll find food. And then there's 10 other spots that may or may not have food or catnip or whatever.
I am envisioning like pirates, like a pirate map of like you have like a little teeny tiny cat ship, and there you could even do this with, oh my God, I'm thinking now. You could do this with like little casserole dishes and put some ice cubes in there for your cat to bat around. You could do like one of those little fish that swims. You could get really, I mean, you could actually make this pirate themed potentially. I'm picturing a little like treasure chest that's like a food puzzle treasure chest that inside instead of gold, there's churu, which is basically the equivalent of gold. Boys, I know what we're doing later. I love the idea of like, okay, there's the core. They know that in some spots there are going to be things, but then they have to go and look at all the other locations because there might be snacks there, or there might be, fun plants, wink wink, or there might be this fun toy there, and you could really incorporate all sorts of different senses where you could do different noises or different smells or different tastes or different like sensory experience. Ooh, I mean, you could have a lot of fun with this.
We'll put up all the cat shelves and we'll do the wand toys, and we know not to or how to do laser toys ethically, things like that. In those situations, we're still kind of missing the hunting foraging component, right?
I have gotten to the point where I have started being like, okay, at the end of the play session, really you should also be ending with like a food puzzle or clicker training or something that you give them that foraging component, and you put the period on the end of the sentence where they have a successful hunt, as the case may be. Even if that successful hunt is you're batting around that adorable avocado food puzzle that shoots treats out of it when the cat bats at it. A really important part of hunting and playing for cats is the actual like searching part of it. So if your cat is watching a toy, they're still really engaged even if they're not going after the toy. And the variable locations that satisfy of the foraging game, that satisfies that need for the cat to look around and to have to do that searching, hunting part of it, which again, just I see that component get missed quite a bit. So I wanted to ask something that we had talked a little bit about prior to actually sitting down and chatting here. I want to hear your hot take on storage tub litter boxes, because I'm not going to lie, we use storage tub litter boxes around here, and you better be careful because I'm a big fan of them. Watch out. Most of this episode is going to be me threatening you, apparently.
The high-walled, what are they, like 13-quart Tupperware bins for litter box?
Yeah.
Where do you some people will do the cut the hole in the top of the lid, and likely the audience that is watching this is aware of some of the reasons that it might be counterproductive for mini cats. Not all.
Why? It's not like I'm quiet about my thoughts on top entry litter boxes. I hate them.
But where do you cut your hole in your high-walled Tupperware? Do you cut it on the short end or the wide end?
So I have typically, just because of where they've been placed, I've done the short end, but I do a really big hole on it. There's advantages or disadvantages to either, depending on placement in your individual cats.
My hot take is, if you have house soiling as one of your behaviors, and there might be some sort of a spraying component to it, if we're not going to do an under the bed sweater box, then if we're going to do the high wall Tupperware bins, cut the wide side, not the long end.
That makes sense. I could see where that would, because that makes it just really easy for them to get in and out. It's nice and big. It's more open. I could see a lot of the advantages for that.
Well, and the other advantage that I think of about this for cats, and again, this is space permitting, right? Because if you're in a 1-bedroom apartment and you barely have spots for your own things, you might only have so many affordances for how you configure a DIY litter box. I also think about how sensitive our cats' hair and whisker sensation is. And even though the short side might be wide enough for the body to go through, it doesn't mean that, especially with our long-haired cats, that they're not feeling the walls as they're walking through. And just like people, some cats are extra sensitive to the sensation of their hairs or whiskers being maneuvered. So that's one of my other reasons that I like to have the wide side of high-walled Tupperware bins. Cut that first, and let's just confirm that your cat will use that. If they do, then we could try the shorter side.
One of the nice things too about the Tupperware bins is that you could always try you could try one of each, and you'd probably end up paying less than you would for the cost of a regular litter box. Just allow your cats the choice and see which ones they prefer, especially if you have a long-haired cat, because I see that all the time where long-haired cats will just not want to touch the sides of the box, even if it seems like it wouldn't be that big of a deal to us. It's ultimately the cat who has to choose to use the litter box. Oh yeah, oh yeah, oh yeah, oh yeah. He knows what this means. The shake of the snack jar. Kind of like how I will eventually be conditioned to respond to the opening of the cheese fridge. Sarah, I have the most important question in the entire world coming up here, so get ready for that, because it's gonna blow your mind. But before we get there, I was just wondering if you have hello. I hear we have another contributor.
Yeah. The baby is crying in the background, and so the dog is also hearing different noises and can't access to go investigate. So there's a couple of don't you hear that barks happening?
Do you have any advice for things that people should keep an eye on with their cats, just in general, that may be a sign that there's something going on, or any questions that they can ask themselves that you should keep an eye out for that may signal, hey, this is something that you should take your cat to a vet, or that there's something deeper going on?
Yes, there was actually a study that was conducted here locally in Minnesota through the U of M and another veterinary clinic. The study had 8 questions. These were yes/no questions. They showed a marked increase in terms of the response of information. So you went from having something like disorientation and nighttime howling in cats in the phase 1 of the study where you didn't ask questions or there weren't questions related to that. There was a report rate of 0%. And after the questions, there was a report rate of 12%. Changes in behaviors.
Holy cow.
Changes in behaviors for cats in the no question portion of the study went from a self-report of 11%. So the pet owners were volunteering information. Without the questionnaire, 11% client report rate or veterinarian inquired. Incorporating these questions, 67%. Significant change in just being able to ask these yes/no questions. So the questions that were part of this study, the first one was, does your cat urinate or defecate outside of the litter box? Question 2 was, does your cat howl at night or seem disoriented at home? Question number 3 was, does your cat chew, ingest, or scratch household items? Question 4 was, if you own multiple cats, do they hiss, growl, avoid, or fight with each other? Question 5 was, has your cat ever been aggressive to another person, including growling, hissing, biting, swatting? 6 was, are you satisfied with your cat's behavior? Question 7 was, are you concerned enough about your cat's behaviors to want to help improve or change those behaviors? And then question 8 was, are you considering adding another cat or kitten to your household? So those last 3 are definitely geared more towards the behavior end. So that's why I have 2 additional questions that I would recommend from a veterinary standpoint, which would be, has your cat had soft stools 2 to 3 times over the past month? And then provide some sort of educational chart for what soft is constituted as. And then the other question would be, does your cat finish all food when offered if they are meal fed? So then there might be some variations to that yes/no question based on how your cat is offered food. Those can be really huge Pandora's boxes for veterinarians, but Pandora's boxes that they wouldn't have opened without having that information in the front. Which, now that I'm thinking about it with you is like, should there be question 11 of like, does your cat vomit after eating? And that has me thinking, is it necessarily a hairball versus, allergy versus other medical, or
like regurgitating?
Right. So is there a medical component, or if there was some sort of patterned food hunt, variable food hunt that allowed for those micro meals, is the scarfing that causes, you know what I mean?
It's amazing how often I have people switch from what I like to call the bookend feeding, which is that like 2 meals, like morning and night feeding, to basically any number of other meals, like even just 3, and things will just improve for their cats. I have a question that I ask every guest here, and it is the most important question you will ever be asked.
Yeah.
It's thought-provoking, it's deep. We're going to learn a lot about you, and you will get a special mark on my chart that you get a special sticker added to it to, again, permanently solidify your answer. And the question is, Sarah, are you more of a poutine or more of a Prozac?
I've been thinking about this, and if we went on name alone, I would probably be a poutine fan if we haven't established that cheese is a primary food group for me. So if we're going on name alone, probably.
Poutine he's a very fun cat. He's got a lot of energy. He's very unique. He's very sweet and kind and adaptable. Where are you located for people to find you on the interwebs? I mean, probably you don't want to give out your home address because that would be unsafe. You'd have paparazzi outside. They'd be like, oh my God, there she is. Actually, Poutine and Prozac would probably be like, we heard you had churros.
Right. Yes, I am. You can find me. My website is Derpy, DERPY, because I've got a derp here, derpypawsbehavior.com. And I have just joined the Facebook this summer personally, in order to join professionally. So you can also find me on Facebook. And I am slowly teaching myself how to navigate some of the socials.
Yes. This is my litter box scooping. This is gonna be a viral trend on TikTok soon. It's gonna be like litter box scooping dance. Well, Sarah, thank you so much for joining. This was fun. I learned a lot. I mean, I also learned that I need to go and order some, not large appliances, but like, I guess mid-size appliances.
There are tiny ones. We use them at one of my old veterinary clinics, like literally the size of like a dog canned food.
Yeah, there's like, I've seen like the teeny, they can hold like 6 cans of like soda or pop, depending on
or like
which,
2 bricks of cheese.
Yeah, or like, again, a couple of like the small, like little chèvre logs. You can get, you know, whatever. And then you can have your crackers nearby.
Have one of those little magnet holders for your...
Yeah, there's a lot of different ways one can set up a cheese fridge. And that is the conclusion of this episode, is that creative cheese fridge setup, it's possible no matter what your needs are.